Welcome to today's OR Today webinar. We have a great presentation for you today featuring David Taylor, Principal of Resolute Advisory Group, LLC. David is a certified perioperative nurse who has more than 35 years of experience working in surgical services. He will share his experiences of consulting with numerous facilities and allow you to examine your own practices and make necessary changes to improve quality and keep patient safety the top priority. We would like to offer a free subscription to OR Today magazine to each attendee today. For nearly 20 years, OR Today has provided perioperative and SPD professionals with up-to-date news and information about their profession. Our monthly magazine aims to educate readers about new guidelines, techniques, and equipment, as well as practical information for career building, problem solving, and overall well-being. To get your free subscription to our magazine, please visit ortoday.com/subscribe. Today's webinar is eligible for one continuing education hour by the State of California Board of Registered Nursing. You can obtain your certificate by completing today's post-webinar survey. The survey will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your 1 CE hour, and you'll be able to download the certificate once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. As I mentioned earlier, our presenter today is David Taylor. David, you may begin whenever you are ready.
Thank you, Jennifer, and welcome everybody. Thank you for being here and taking some time out of your busy day to be with us. I want to thank OR Today for inviting me here to speak with you. During the presentation, I am going to pause my camera so there's no distraction there. You'll only see the PowerPoint itself. Part of my background is I retired from the U.S. Army as an Army Nurse Corps officer in 2009, spent about 10 years consulting. Still consult today, but not as often as I used to. I was on the road every week in the past 10 years. So it's been kind of a long haul. This presentation is a culmination of many of those visits. You're going to see a pictorial representation of what hospitals are doing across the country. So hence, sterile processing, a look at what's happening behind closed doors is what you'll get. We have a few videos and lots of information to provide. So lots of slides here. I'll go as quickly as I can. And at the end, we have some question and answers. So if you have any questions out there, don't hesitate to ask during the presentation. Jennifer will be keeping track of that. So here we go. So sterile processing, an honest look at what's happening behind closed doors. I have no financial affiliation with anything that perceived posing or potentially a conflict of interest. As I said, as a consultant, I go around the country, and oftentimes in your own communities, you see billboards in and along your freeways. But if your billboard said you had cracking, chipping, flaking surgical instruments, and they're being used in your open heart procedures, brain and spine surgery, pediatric trauma, or any other procedure that you perform at your hospital, do you think you'd have much business after 1,000 or 10,000 or whatever cars travel that freeway that day? Probably not. But what we're seeing across the country is a lot of things that are going wrong. This is not particularly just focused on sterile processing and what it's doing, but a culmination of both surgical and sterile processing, because there's a partnership there, as we all know. Perception is reality, right? So in your own mind, you see what you see and you think you're doing a good job at it. In fact, most of my clients feel that they're doing a great job until I come in, and I give them kind of a sense of different things. So surgical services, sterile processing, all those leaders really seem to understand that what they do, and they're doing it well. But then I give them a different perspective because I'm seeing it from a different angle, a new set of eyes, fresh ideas, and up-to-date knowledge of what's going on in our industry and what the guidelines, recommendations, manufacturers' instructions are and how things are changing. So the first photograph here that you're looking at is a sterile processing department, and it's in a very hot climate. In this department, what you're seeing is windows, and in the windows they have blinds. So if you have blinds in your sterile processing department, wherever you store or process your equipment, please take them out. They collect dust, they're very difficult to clean, and they're an infection control nightmare. The problem here was these were single pane windows, so this was a very old facility. And this first picture on the left was taken in the morning before it really got hot out. But later in the day, that same window started fogging up because of the air conditioning on the inside. So cold air and hot air mix causes condensation. And the picture in the middle is the way they were storing their instruments. And you look between or through that picture, you'll see that window. So that is kind of what happens. With the blue wrapper, as you know, we try to store them properly, and if they touch the window, they will absorb that water, they'll have strike through, and those instrument sets will be contaminated. Here's an operating room that I recently visited not that long ago, and this is how they're storing their instrumentation. So once sterile processing, working so hard to get everything processed for them, this is what the OR does with it. Photograph on the left, you can see a bunch of drawers. Some of the drawers are left open. They're overstuffed. The packs, the peel packs or peel pouches, if you call them that, are not stored flat and or very well. In fact, this, the very bottom part, you can see the one drawer is overlapping another peel pack. So probably contaminated, probably a hole. And then who gets the blame? Sterile processing. In the middle pictures, you're going to see instruments on their sides. These instruments should actually be stored in a flat single level, but you can see how they're storing them here. You also have blue wrapper on top of peel packs. The picture on the right, same thing, overflowing. You got stuff on the floor. And what's even more alarming is you have x-ray gowns. Here you have two different ones, a flower one and a butterfly one, that's actually next to sterile items. And most of you probably know these things don't get cleaned frequently. So you've got dirty, wearable, protective equipment next to sterile stored items. The last picture in the middle, bottom, is double peel pack. Double peel packing is still acceptable. However, the internal peel pack cannot be folded over in any way. It must fit into the outer peel pack flat, without any creasing, without any folds. And here, you can still see ORs across the country are doing that. This standard, by the way, changed about a decade ago, but we're still seeing it in our industry. Storage of your instruments. Everybody complains about holes in the blue wrapper, and the companies that manufacture these wrappers are trying to make them thicker and more durable, yet OR folks are so clever they can figure out a way to put a hole in it, and then everybody else gets the blame except that individual. So here you have some canisters. In this case, it's a Stryker 70-degree scope next to two other canisters of the same type, next to and on top of their blue wrapper. Center picture, obviously, next to a water source. So when you wash your hands, you reach over for soap. You wash your hands, you dry them, etc. But yet water and sterile items really don't go well together. So a lot of problems there. And again, another OR, you see blue wrappered items inside a drawer with metal canisters on top of it and peel packs next to it. So these are simple things that are easily fixed within your operating room and your central sterile processing. And you would think that this is a no-brainer, but I was just at a clinic site in South Central Texas, 21 clinics in all, and all the things that I found were astronomical. And it's amazing that people still think today that it's okay and acceptable. Again, you've got metal canisters on top of blue wrappered items. One here on the left is sandwiched. Bottom center picture, they're stacked on top of each other next to a blue bin, which happens to hold all of the manuals for all of the electronic equipment, which, by the way, are never read. And I know this because I could scoop out the dust bunnies with my hand. That's how long those manuals were inside that thing without it being cleaned. And of course, we need a bottle of shampoo stored next to and in our cabinetry with sterile items. The picture on the right was a cart that has been in use for years at this organization, and they just felt they wanted to get a little bit more life out of it, so they'd keep using it. So they put very heavy orthopedic instruments on it. You can see the little gray pan, which is the pan that we use in our industry to try to prevent holes in our blue wrapper. But what happens, because this shelf is broken, it slides off, it hits another metal shelf, causes a hole, and of course, now you have a surgical delay. Question here is it sterile or unsterile? Well, I found this inside a sterile storage room. It never went through the sterilization process. Not sure how it got all the way from SPD to the operating room, but it did. Luckily, while I was on my assignment with this organization, I found it, brought it to their attention, but not before I take a picture of it, because sometimes the leadership doesn't believe that this kind of stuff is happening. Where does point of use cleaning begin? If the audience was in front of us, somebody would probably have said in the operating room. In reality, it rarely does. So theirs is a very busy operating room, does a lot of heart procedures, a lot of thoracic procedures, etc. And this is how they send their instruments back to SPD. They're stuck into a disposable plastic basin that they got from their custom pack, and they're left bloody. And here were 3 pictures on your right that we pulled out of that basin, and this is how they looked. For your understanding, it's the operating room's responsibility to keep these instruments cleaned. When I started my career 35 years ago, I scrubbed and circulated my cases, as well as went to SPD to put my own instruments back together. I don't know what happened in our industry and when all of this changed, but OR technicians and nurses who scrub don't clean their instruments like we did 35 years ago. But every time I received that instrument back from my surgeon, I cleaned it with a sponge. Either it was a lap tape or it was one of the disposable hand towels that we had in the pack or something. But my instruments were always clean, so they went to SPD clean. Many organizations are busy. I understand turnover times. We got to get them less than 20 minutes. In some cases, in ambulatory surgery centers, it goes much faster. So we started implementing gels, right? Enzymatic gels or enzymatic sprays. In most ORs, they're still not using the enzymatics. When the blood dries on this instrument, it's harder to clean. It causes pitting, which reduces the sterilability of the instrument itself, as well as the life expectancy. So those Metzen bombs and Mayo scissors there, they're going to become dull over time because the proteins from the body fluids and or blood will degrade that stainless steel. How many of you got tape in your ORs? If any of your instrument packs are like this, none of your instruments are sterile. The tape that you see on these cases, which are holding instruments, are not designed to go inside an instrument set or on the containers themselves or on the baskets or on anything for that matter. So this is how this instrument is cleaned and sterilized every time. It's put in blue wrapper. It's sent up to the OR. They open it and use it every single time. And when I question them, how do you know that steam is actually penetrating this tape? Nobody could answer. Oops, nobody could answer that question. You're not supposed to tape your integrators onto your items as well. The glue that's on this autoclave tape is not penetrated by steam. It's not designed to do that. It's an outer use only. But you'll see this everywhere in the United States. They're labeling and using tape for their instruments. The other problem, and you're going to see this in future slides, is this little sticker that we use. Many of us are buying these stickers from Staples, which is a sticker gun. And those stickers don't have a manufacturer's instructions for use to use in steam sterilization. They are not used or not supposed to be used in your SPD and your OR environment. So my recommendation is if you're using them, stop, remove them from all of your pieces of equipment, and we'll show you something at the end of the presentation as an option for you. In this case, you've got a glycine bag, which is still acceptable, but you can see they're using autoclave tape to label stuff. Unacceptable. Here's some old tape that was on the basket. They keep reprocessing those instruments. Here you've got a loaner set, And you know, in orthopedics, how hard we work to keep our patients from getting an infection, particularly in the bone. And yet the simplest thing we can do is keep our instrument sets, pans, and devices clean and tape free, but yet this is what's happening. Here again is that label maker on top of the little cassette, if you will, with the silicone ribs. They're used here also. So you see that it's happening. And these pictures are not just from one place. I visit about 200 institutions total in my consulting career. On average, it's 20 to 30 a year. So I'm pretty busy, and I refresh this PowerPoint presentation very frequently with new stuff. If you're using rigid containers, awesome. You're using something that is very durable, but realize that they need to be maintained as well. And maintenance will vary on the manufacturer, of course. In this particular example, in the next slide, you'll see that these canisters are an older generation, and because they're so durable and reliable, they can be used for many, many years. But in this case, the photographs will show you not just the center, but some close-ups of the dust that was on the lid. Now this lid has two lids. This is the outer lid, and this is the inner lid. The inner lid fits in with a spring device, and the circles that you see on your screen are ceramic filters that expand and close when it hits the right temperature and pressure in your steam sterilizer, and then they open when they get washed through their wash cycle. What you see on the center picture left near the circle is the dust that you see as a close-up on the left side. So this is never cleaned in between use. And then when I ask the client if they take the inner lid out to clean and inspect, they said, oh yeah, sure we do, no problem. Or they don't know that they're supposed to, and this dust that you see in the center in the upper portion is to your right. That's a close-up. And that was the color of their scrubs. It's a little bit gray in this picture, but their scrubs were kind of a light gray, kind of a taupey color. So you can see that most of this lint probably came from their scrubs. This was another lid, so you can see it in place with the spring. You take it out, so here's the outer portion, and look at all the dust and a little bit of hair right there, and a little bit right there. If my arrow is showing up on the screen, that's what's happening in our industry. So is it really sterile if you have all of these problems? How about bugs? Do you got bugs? Well, in this case, I had one of my technicians that I was working with just call me if he ran into any problems, and he did. He said, Dave, this is what happened when I pull out the basket. We had a cricket. And what we found was that the lid and the top portion, the lid, and the bottom portion, the pan, were not maintained very well. They were dented. So they were just misaligned. And what ended up happening is, of course, a cricket got in from the bottom of the pan through the lid and ended up dying during the sterilization cycle. Here again, you can see the glycine bags and the masking tape. In this case, it's the blue masking tape that changes colors, but that instrument set is technically contaminated even if it didn't have a bug in it. How about maintaining your equipment and the chemicals that you use within your sterile processing? Here are a couple pictures of the autoclaves on the left, both the inner and the switching areas. You can see all the dust buildup. Nobody seems to clean. Dust can be very contaminating in some of our instances. So cleanliness is important in our environment. To the right, you're going to see chemicals that are used for the washer decontaminators. And you can see in the background, you have the water softeners. Not only were the containers empty, dirty, leaking, as you can see sheets and towels and bath blankets on the floor, there was no salt in the water softeners. So they weren't even, their water quality wasn't even to the standard it needed to be. In the bottom center picture, you can see the 1 gallon jug that was leaned over just slightly because we want to make sure we get every last drop out of that before we change it. The unfortunate part was this was empty and had been probably for many, many weeks before I showed up on this assessment. The problem with this is not only is it not cleaning your instruments properly, but when instruments come out of your washer decontaminator, they are cleaned to a standard that is safe to handle without PPE. So your sterile processing technicians can handle this equipment, instrumentation, etc., without any PPE, gloves, gowns, masks, etc. But now, how many times were they exposed? So not only are you a problem with infection prevention, not only are you a problem with possibly a workers' comp claim because an employee got contracted hepatitis, HIV, or something else, because we have a lot of sharp instruments, you have needle sticks, you never know what's going to happen. So it's critical that you manage your chemicals and your equipment. How about your loaner trays? How many of you do loaners? Probably the majority, if not all of you on this webinar today. What you're seeing here is a series of pictures for this room that I'm going to describe. The first picture in the upper left is me taking the photograph just off a set of elevators. So in this operating room, the elevators came up, and this is what you've seen. This is where the vendors came in. So they came up this elevator and entered this room because this was their quote-unquote loaner room. As I got to the doorway, you can see the same carts that were in front of us on the first picture, except you start seeing some of the internal and external shipping boxes. You see an anesthesia cart, and then you start seeing the loaner instruments on the assigned carts. Most of those carts are open. Either they don't have a dust cover or the dust covers are wide open. Some are closed. As you come to the right, middle, upper, you'll see that the room is now moving to our right, and you can see some of the other equipment that's in there in storage. And of course, the bottom right gives you all of the waste and stuff that they store in there. So you have loaner instruments coming in without being checked by any OR or sterile processing personnel. It's under the complete control of a vendor, so you never know what's coming or going. They could show up at 2 o'clock in the morning and take 5 of your instrument sets, and you'd never know it. And this hospital thought it was acceptable because they were sterilized at the last sterile processing department at the last hospital, that it was acceptable to consider that sterile. So anything that you receive from a vendor, whether it's been sterilized or not, has to be opened, inventory, inspected, and re-cleaned. Far too often we're finding bioburden on these instruments to begin with. In our own institution, you can't trust what other institutions are doing. Plus, you should have a lot more control over your vendors. How about medical supply manufacturing? This was one of my clients who I just happened upon at the nurses station, and one of their registered nurses was putting these devices together. When I questioned her what it was, she goes, "Oh, these are our endoscopic cholecystectomy pouches." Well, further questions were, why are you using Great Value, which is a generic Walmart brand, sandwich bag, and Tycron suture to make a pouch? And she says, "Oh, we're saving money." Our surgeon brought up the idea to administration, and our hospital president thought it was a great idea and blessed us to do this. So the first question I asked is, I'd like to see your 510K. And do you have an instructions for use, since you're the manufacturer? Questions that anybody should ask when you're using a medical device. Well, lo and behold, everybody approved of this, and they wondered why their infection rate was so high. So if you are making your own pouches out of Great Value generic sandwich bags and using your suture, please stop. So where did you say that instrument was located? I know many of you are probably looking at this saying, well, that's my operating room. And if you look in here, it's always the one item you need is always in the back underneath the heaviest equipment, or it's in some kind of disarray. So here's 2 examples. You know what your storage rooms look like. Unfortunately, storage rooms should be neat, clean, orderly, organized. You should be cleaning your shelves. The containers, those little blue and yellow bins that you see, should be cleaned routinely. I like once a week because dust formulates very quickly. The bottom, in the picture on the right, you'll see on the bottom of the tray, there's another x-ray gown that just happened to be laying on that wheeled cart. And guess what's on top of it? That's your sterile custom packs. So pretty typical of what I see across the country. How about you exercisers, bending and reaching? This is the same nurse who went to her sterile storage area to retrieve items that she needed for her case. In the picture on the left, you see her buttocks rubbing against sterile instruments. Instruments should be stored in an area where there's very low traffic, obviously humidity and temperature controlled. But when she bends over, anybody bends over frequently, they rub against the equipment. Lo and behold, you have holes in your blue wrapper and you wonder why. In this case, she wasn't very tall in the right picture, and she's stepping on the bottom shelf, and what happens to be there? Blue wrapped instruments. Again, wondering why we have so many infections in the operating room. Why are there so many holes in the blue wrapper? This is just two great examples. In addition, look at how they're storing their instruments. They're stacking them on top of each other. Again, blue wrappered items are not supposed to be stacked on top of one another. Maximum weight of an instrument set should be 25 pounds. Unfortunately, many of the instrument sets are above 25 pounds. You see metal canisters on top of blue wrappers again. You see stuff tilted and leaning. All kinds of problems here. Total nightmare. It took us 8-9 months to fix all of these problems at this hospital. How many of you are using the Sonic machine in your vascular procedures or your open heart procedures? I would think that many of you are. This is the industry standard. What you're seeing in the top left are the 3 probes that go to this machine. When you order the probes, they have to be a certain hertz, megahertz that is correspondent with your machine. Typically what you see is they're peel packed and sterilized using steam sterilization. Some folks are moving towards a low temperature sterilization. However, whoops, back in 2015, Parks Medical sent this out to everybody. These are supposed to be used for non-invasive diagnostic procedures, not under the skin. They were not designed to go under the skin. They were not designed to be re-sterilized. And we've been doing it for years. So ladies and gentlemen, if you have the Parks Medical Electronics ultrasound device, please stop using it in surgery. You don't want there to be any issues with your equipment in your operating rooms. AORN guidelines for perioperative practice. I took this out of the 2019 edition. There is a new edition, a new edition out. I just checked it and none of it's changed. I will change this slide to correspond. But it talks about the handling of instrumentation, how to, the collection, the transport of contaminated items, the disassembly of certain instrumentation, and the fact that you should be using instructions for use. The area that I highlighted is what I really want to kind of talk about, because as we move into some of the next slides, it's going to be very important here. The device manufacturer's written IFU, which is instructions for use, for placement should be followed. In addition to following those recommendations, you then have additional items. So ratcheted instruments should be unlatched. Racks, pins, stringers, and other specifically designed devices can be used to hold instruments in the unlatched position. The reason I bring this to your attention is AORN, I love it. I'm a big part of it. I was elected to a position for 2 years, so I am full on AORN. However, when we look at what's going on in our industry, we have to look at how guidelines are written, the frequency in which they're updated, and then some common sense approach to what we're doing. I had a client recently who argued with me that one instrument ratcheted on the stringer that happened to be closed contaminated the whole instrument set. So we kind of talked through it. Looking at steam sterilization, steam is a molecule and it's very small. But because we are so hard fast and say that this ratcheted instrument is not sterile according to this statement, the whole instrument set is contaminated. So we argued through it and we said, okay, at the worst case scenario, that particular instrument is contaminated and should be removed, taken off your count sheet and placed somewhere so that it can be found and replaced into the set when the surgical procedure is over. Well, they were steadfast and said, no, 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 that's not the rule. Everything's contaminated. So they were creating their own work, more work for themselves, creating more work for sterile processing, causing their physicians, their surgeons to question their abilities, both in the operating room and in preparation for the surgical procedure. So I had a long conversation with my client. We had several meetings on this, and at one of the meetings, I started coming in and bringing some things to their attention. So here's a little pause just to kind of laugh a little bit, but how many of you in surgery have folks that don't wear their masks, or wear their nose outside of their mask, or wear no mask? Or how many of your anesthesia providers have their hair out? I mean, this is kind of a funny joke, long standing cartoon from many, many years ago, but reality is I think you could probably find a couple of your ORs that are doing this. So back to the presentation itself, we talk about a ratcheted instrument, A01 standard. So my client was dead fast on that ratchet. So I said, okay, what about the Gelpies and the Wheatlanders that are in your set? There's ratchets, but there's no way to disassemble that ratchet. So are those instruments contaminated? How about your gouges and your bone cutters and stuff? You have a spring that's at the bottom, and this is a very heavy spring. When you squeeze the handles together, you move that spring. So anything that's underneath in this joint is now exposed. Then what about the pressures here? If you take a mosquito, pounds per square inch to open is probably a couple ounces. However, the pounds per square inch for this joint to open, as well as these other joints, is pretty significant. So between the spring and the joints, can you say that this instrument is sterile? Or how about this gooseneck? Same concept, except this is now riveted. And when it moves, it still opens up that joint. You also have some of these tight fitting areas, and you can see the half circles here is where the instrument pivots. Are those instruments sterile? So if we're using the same guideline and manufacturer's instructions for use, would this be considered contaminated? Or how about some of your other instruments that do not come apart? Obviously, there's a long seam here, and when you open it, that seam moves both forwards and backwards. Is that contaminated? And let's talk about yanker suctions. So this same client fought me and fought me and fought me on the ratchet. So nothing that I gave them mattered. It was contaminated. However, when I said you have multiple yanker suctions in your inventory, these are only two. So all of the ones that they had were very different from one another. So different year manufacturers, etc. And I told them that these are typically difficult, if not near impossible to clean. So if we cut them open, you're going to find rust, probably some bioburden, potentially some other problems with them. And they said, well, this is what our surgeons like. They don't like the plastic ones. I said, but we're talking about contamination here, and you're creating a workload for sterile processing as well as yourself by eliminating an instrument set over a ratcheted mosquito. Well, that's just the way it is, and that's the standard. You kind of know how the argument goes. Well, we did cut this in half. We cut all of them, one of each, in half. So we had Biomed do that for us. And on the interior, you could find rust and all kinds of problems because it's not a single chamber. This tube and this tube goes in, is basically soldered at the tip. Then this, as it flares open, is hollow. This one as well is hollow. So even if I stick a brush or a cotton swab or something, pipe cleaner in here, I won't get all of the surfaces. Even when I place it in my ultrasonic, it won't remove everything. So we fought very hard with this. We worked with the surgeons, we re-educated them, and the surgeons were like, well, why didn't you tell me these weren't clean? We could have eliminated this years ago and just used disposable. What it came down to was kind of a sacred cow kind of mentality. Was this is the way we've done it, this is the way it's always been done, and this is the standards, and this is what we're going by. So use some common sense, read all of your manufacturer's instructions, and just make some educated decisions, because none of it's going to match. 5 different instrument manufacturers are going to have 5 different instructions for you to follow. It's near impossible. But if you use the standards and you make the best educated guess you can make based on the science, you're going to be fine. So what you accept is what you teach. So if you teach your nurses in your operating rooms to throw out an entire instrument set because that's the AORN standard, fine. You may not have another instrument set until that can get reprocessed. You have a patient under anesthesia. You have to figure out what's going to be worse. But if what you accept as a leader or as a nurse or technician or sterile processing professional, and you've seen the pictures that I've seen, this is what you're teaching your staff. The world is watching, and that's why I put the bulletin board or the billboard out on the first slide. Everybody sees what's happening, and the news feeds are ready to pick up at anything that you guys are doing wrong. The general public is acutely aware and are educating themselves on all the procedures that need to happen for themselves, so they know what to expect. But here's a little video for you to maybe help clarify some stuff.
Morning on Today investigates an inside look at what goes on behind the scenes in the operating room. NBC News partnered with the Center for Public Integrity to tackle what experts think is a growing problem. The surgeon standing over him in the operating room. But unknown to most people, including John, surgery doesn't start in the OR. It starts here, in a basement of the hospital where instruments are cleaned, sterilized, and reassembled. But new research shows that too often, surgical tools leave the basement still contaminated with hidden blood, tissue, and other debris, then used to operate on patients like John.
We were told that the recovery time for rotator cuff surgery would be about 6 weeks, and just through physical therapy, his shoulder would be restored.
That didn't happen.
Something was wrong with my shoulder. Something was bad wrong.
2 weeks after the surgery, John's wife, Laura, rushed him to the hospital where he was told he was infected with a potentially deadly bacteria during his surgery.
It was a nightmare. It was really frightening.
An investigation found that dirty surgical instruments had infected not just John, but 7 patients at the hospital during a 2-week period. And it's happening across the country, with multiple outbreaks reported over the last 2 years. But because only 25 states are required to report surgical site infections, experts worry this is just the tip of the iceberg.
If we do not do our jobs correctly, we can impact a patient's life. That's the reality.
Sharon Green Golden is the head of the Sterile Processing Department at Bon Secours Hospital in Virginia, which is not the hospital where John was treated. She thinks of her team as the unseen patient advocates.
It is a job that cannot be given to robots because the robot doesn't have the critical thinking to say, this is still dirty, I need to clean it some more. Sterile processing is one of the most important jobs in the hospital.
Green Golden has made her sterile processing department state-of-the-art, a model for what should be happening across the country. Yet she says in most hospitals, people who are paid to do this work are hourly minimum wage laborers, and in every state except New Jersey are not required to have any kind of training or certification.
Your hairdresser has to have a license. The barber has a license. The dog groomer has a license. The tattoo artist has a license. And I'm dealing with instruments going in your body. I'm not required to be certified.
Johanna Cezi, a risk management clinical engineer at the University of Michigan Health System, has done eye-opening research that shows even when technicians follow cleaning instructions, oftentimes the instruments still contain debris. Oh, it's not even an old instrument.
No.
Oh my gosh. Now you've shocked me. Now you've shocked me. I mean, I would think that that's perfectly fine, and you open it up and that's pretty horrifying. Assisi ran a tiny video camera through 350 suction instruments that had been sterilized and deemed ready for the OR. It looks pigmented. It could easily be blood
Or rust.
or rust. It shouldn't be there.
Yes.
Okay. All contain some kind of debris. Do you know how many times in my life I've used a suction like this? Thousands. Thousands. Aware of the problem, the FDA recently had a meeting where Johanna Cezi presented his data. The FDA requires manufacturers to provide specific cleaning instructions for each surgical instrument, but the testing is done in a laboratory setting and not in the real world. And if a dirty medical device finds its way into an OR, the FDA does not require hospitals to report it. The FDA declined to do an on-camera interview for today, but gave us this statement. Hospitals are reminded to carefully clean and sterilize reusable medical devices. A patient's risk of acquiring an infection from a reprocessed medical device is very low. For John, what was supposed to be a 6-week recovery has turned into a 3-year nightmare.
Changed my life. It changed every aspect of it. Thousands of days of waking up with pain.
A surgery that was supposed to improve his life has led to 7 other surgeries, constant pain, without full use of his arm.
That's what I have to do.
We asked the Advanced Medical Technology Association for a statement, and here's what they said. The medical technology industry is committed to providing patients with safe and effective medical devices and diagnostics. Ensuring the proper reprocessing of reusable medical devices is a shared responsibility between the FDA, device manufacturers, healthcare facilities, and physicians. Now, it is important to point out that this is a relatively rare phenomenon, the idea that you could get an infection going in for a clean surgery. But with the more advanced, complex surgical instruments, the real issue is the cleaning now has become a much more difficult process. And again, I want to thank the Center for Public Integrity because they were a real help with this investigation.
It's very important reporting. You think that they should be certified, the people then who clean these instruments?
There's no reason not to have it certified. You know, we went to the University of Michigan where they have the money in the bowels of the hospital to really have a big reprocessing plant. But as you look at community hospitals where this becomes an expensive process, then third parties to do it, I think, frankly, this is a shared responsibility where the ball is being dropped. Who pays? The patient pays.
Again, and it comes down
It's
to
first do
money.
no harm. At the end of the day, no matter who you are in the medical system, first do no harm.
Dr. Nancy Seidemann, thank you so much.
You bet.
Important reporting this morning.
So I wish I could see your reactions. Most folks that see this video are pretty shocked at what they see, but between the pictures and the video, you're getting a good, clear picture. The thing that I would disagree with Dr. Nancy Seidemann is that it's not a rare phenomenon any longer, and it's happening more and more frequently. Good examples, and I'm going to blow through these slides very, very quickly, but you've got about 20,000 surgical instruments and instrument sets that have to be removed and replaced in this hospital because of CJD. 10 patients that underwent both neuro and orthopedic surgery are the focus of their concern. North Carolina hospital, this is Duke University, washed instruments with hydraulic fluid. And there's a long story behind this and years of legal battles. 5 women were contracted staph infections at St. Mary's. Here's another video, but because of our time, we'll go through. But this is basically a physician who became a whistleblower because the hospital refused to change their practices. You got filthy surgical instruments, a hidden threat in America's operating rooms, and more patients are becoming infected and patients are dying. 8 patients in New Hampshire were exposed again to CJD. New Orleans, allegedly using unsterile surgical equipment. I've done 3 CMS surveys. because hospitals were not sterilizing their instruments properly, and CMS came in and threatened to take away their funding. There's outbreaks of CRE. We know this with the endoscopes. Are they safe? They're better, but we went through a lot of problems. Here are some of them. Superbug found in a Chicago suburban hospital. Scopes were not disinfected properly, affecting hundreds of patients. I was in an airplane when I read this USA Today. And if you look here, this little story is this bubble on the upper left side of the front page. But when you opened up, you had a full page description of the problems. What better marketing campaign to try and fix things? But nothing's gotten better since this came out. Deadly superbugs infects patients in a Seattle hospital. You got multi-drug resistant superbugs with at least 32 patients affected. Again, more patients, 179 of them were exposed to life-threatening CRE. And this is all over the country, folks. 281 patients in the Hartford hospital. And it goes on and on and on. 12,000 children affected at Seattle Children's. You got 11 patients who died because of dirty scopes. 293 patients exposed to hepatitis, HIV at a Bay State hospital. And you can see it goes on. A Methodist hospital here in my hometown, San Antonio, Texas area. Woman was on TV crying and crying because they didn't sterilize their instruments prior to use. Again, Detroit Medical Center, been in the news for years. More recently, 2 doctors were awarded $10.6 million. The hospital had retaliated against the physicians because after the physicians asked the hospital's leadership to make changes, they didn't. They also identified other areas where they were improperly billing, so it came lots of problems. $10.6 million awarded to those 2 physicians. Other hospitals throughout, you can see the dates. We started off about 2012, we're up to 2017. This is Brooke Army Medical Center here in San Antonio. They even had problems. And I've worked in this facility and have seen their sterile processing, and they have some stellar processes in place, but they still had problems. VA continuously has problems year after year. And it goes on, San Diego Hospital. So you can see it. And if they advertise this, if you have not heard, we are understaffed. We are underfunded. Our central sterile processing department for years. As a result, we may put you at risk for life-threatening illnesses that could result in death. Call to schedule your surgery today. If you were driving by that billboard and knew what was going on in your local hospital, your community hospital, your medical centers, would you want to have surgery? So who's running the hospital? Who's on the board? What is the board doing? Why aren't they funding this stuff? What is the medical staff thinking? Do they even know? Are your physicians educated? Are you educating them so that they can help you fight the good fight and get the battles won? Why is it so important? Well, it's not only important because it's a humane perspective, but it's what we do. It's who we are. Surgical services is a revenue generating department, and without it, other areas of the hospital can't function well. Hospitals depend on surgical services for greater than half of their margins. And in better performing hospitals, it can be as high as 60% of the hospital's margin. And that's what allows you to have a women's center, a cancer center, a pediatric center, whatever. Without surgery, you can't run a hospital. But I want you folks to know that it's not all bad. Okay, there's a lot of good stuff happening out in the industry as well. This is just the worst of the worst. And the few pictures that I'm going to show you are the few that are doing it well. These folks here they actually worked for me a number of years ago. And my philosophy when I run my operating rooms is if you got time to lean, you got time to clean. And I will tell you, that's for everybody. Because if the director can get on his hands and knees and clean, you better gosh darn well, you're going to clean too. We didn't have tape anywhere, no goo, no sticky anything. My floors were clean, my walls were clean. My staff did not like when they seen me in scrubs because I knew they were doing some deep cleaning that day. Here's a good example so you don't have to use all that tape we demonstrated earlier in the presentation. This is a wonderful little tray. What you can see is all of these little blue divider pieces are screwed in place by the manufacturer, and on the outside there's actually a little laser engraved piece of metal plate that is welded or attached to this basket that identifies what it is. When you're working with your chemicals, remember we seen that container that you could not see through and it was leaning. This is actually on the sink or countertop with a sink with the actual tape in place, so you know where to fill the water. You press the little button on that blue box and it extracts the perfect amount of chemicals into your sink. They do the same thing with the washer decontaminators. You notice that the device on the floor leans the canisters a little bit to one side. I think it was approximately 20 degrees, and that just makes sure that you get as much fluid, chemical fluid as possible. Plus it's opaque, you can kind of see through it. You can measure and change out your chemicals as necessary. Whoops. This is the way you should be storing your blue wrapped instruments. This was a client I worked with for a long time. Their stuff was stacked and ugly and mismanaged and lots of holes in their blue wrapper. And after working with them for a long time, doing some lean technologies, processes, we were able to get all of their blue wrappered items individually on their own shelf. And as you notice, as this technician is pulling the instrument set off, the shelf comes with it. She puts it into the case cart. It goes on its own shelf. This is the handle product. It's called a Rotomat. It's a device that goes high up into your ceiling that you don't see, or goes down through the floor into your basement, depending on how your sterile processing department has been constructed and where it's located. And all the instruments that you see in the upper right picture, it just rotates up on a carousel. So you can pull not just disposable items, but sterile items as well. I love this machine. I've seen it in use a few places. Absolutely wonderful. Space saver as well. So you've got a small department. This is easily retrofitted, and it will triple, quadruple, and even times 10 your storage capacity. In the long history of humankind and animal kind too, those who learn to collaborate and improve, improvise most effectively have prevailed. Charles Darwin, and of course Homer, if you're a Simpsons fan. I don't know that he really evolved very much from that first chimpanzee. Okay, it's time to evaluate the standard of care being practiced in your facility. If you don't know where to start, call me. Your patients are counting on you to do the right thing. We'll open it up for some conversation or questions, and the contact information below, you can either reach me by email or by my cell phone.
Thank you so much, David, for that very valuable information. I'm not sure if you can go back. There you go. That's perfect. We do have a few questions that have come in, but as a reminder to our audience, if you do have any questions, please use the questions feature on your webinar dashboard to submit those. We'll get to as many as we can, and any that we can't get to, David will receive those after the webinar. Our first question is, we are expected to turn our operating rooms very quickly to get the next case started, and I don't have time to clean my instruments before sending them to CSPD. Why should this be a concern for the OR?
So this is kind of a multi-layered question. Why is it important for the OR? Because the instruments that you don't manage well through the cleaning process, whether you clean them at the end of your case or whether you clean them throughout your case, you're reducing the life expectancy, and instruments are very expensive. And I would venture to say that you probably don't have enough instrument sets in your operating room to begin with. And if you let the pitting occurring, the rusting, etc., and you don't have your instruments in a repair system or program, the life expectancy is going to actually cost you time, because instruments are not going to be sharp, or they don't function the way they're supposed to function.
All right, our next question is, what is the storage system that you showed at the end of the presentation? And there wasn't anything specific to reference it, but that was the full question.
Okay, yeah, so I'll go back to that slide. I think I can go anyway back to that slide. It was Rotomat. It's by Hanel. It's a German company, Hanel. And again, I do not receive any funding or payment or kickback or anything from any company I would recommend. This is just one system that I seen in place and I really liked it, so I took a few pictures. I did talk to the rep at one time and told her that I might use it in presentations, and she was fine with that. But Hanel, Hanel, and it's called the Rotomat.
Thank you. Our next question is, if storage space at an ASC is very limited, how do you avoid storing wrapped trays on top of one another?
Yeah, that's a hard question to answer because for me, I'm a visual person. When I do my lean processes, I look at all of the spaces to identify where we can potentially go with that. So it depends how you're storing them now. If you're storing them with what is it, the Medline wire meshed shelving, what I would first look at is, one, how is that shelving organized? Is it flat against the wall? Are you using it like an accordion where you have one shelf that's fixed and 5 or 6 shelves that are on wheels so that you can move the shelves right or left? That'll save you square footage and allow you to add more shelving. There is a metal panel system that you can apply to your walls, and in there you can place plastic bins and they clip in place. That'll also save you a lot of without having to require new construction. The additional spaces that I would look at is what's between your instrument set and the shelf. So on the top, measure from the top of your instrument tray to the next shelf. If you have any inches there, you can lower that top shelf and add some space. And if you do that in enough shelves, you can sometimes add 30% more storage capacity. The Rotomat is another great example because it sits where you visualize the opening, but where most of the Rotomat sits is maybe 20 or 30 feet above you, behind or underneath that drop ceiling, or it can go down into the floor into your basement because it's very elongated and you can put thousands of instrument sets in there.
Thank you so much, David, for all of this wonderful information and a great presentation. Thank you to our sponsor, Resolute Advisory Group, for the services that they provide to our industry. A quick reminder that you can obtain your continuing education certificate by completing today's post-webinar survey. This will be emailed to you 1 hour after we conclude. You must complete the survey to receive your 1 CE hour, and you'll be able to download the certificate once you submit the survey. If you have any questions, you can reach us at webinar@mdpublishing.com. We will be back soon with another webinar. Please visit ortodaywebinars.live for more details and complimentary registration. Thank you all and have a great day.
Thank you, everybody.